when you have a major life stressor, so think like, you know, a job loss, a death in the family, births of children, like all these different major life stressors, it's expected that afterwards for, around 6 months that you would be experiencing some symptoms of, mood disruption, anxiety, stress, sleep, appetite disturbances, worrying, all these sort of things are actually pretty normal, right? Like when you have one of these big life events, it's pretty normal to feel stressed out. Especially now with COVID, I think that's even worse. And we're experiencing that kind of collectively as a nation right now. So, like you guys are saying, like having to worry about Thanksgiving, the fear of going out, missing hugs from people. Like these are things that are really stressing people out. And we have now been dealing with COVID for well over 6 months. So traditionally, when people have dealt with these major life stressors and, they're still in that kind of 6 month window of what we would expect people to kind of be, struggling with some emotions or with some, kinds of physical symptoms when people get down or anxious, which I'll be kind of talking a bit, more in a few. That's really considered more of an adjustment issue and it's normal. But when it starts to last longer than 6 months, or when it really starts causing problems for you, distress, interfering with your social life, home life, your relationships, your work, then can't buy a turkey that feeds 12 people. Yeah, exactly. So this is like when those things become more of a clinical issue, right? So how do we distinguish between, if you're just kind of depressed because of COVID, or is it a regular depression? Well, I would venture to say at this point, if it's gone on for more than 6 months, and if you're experiencing the symptoms of depression, which, the two core symptoms of depression are going to either be a feeling sad, hopeless, down, or low, most of the day, nearly every day for a couple weeks. And then the other core symptom of depression is this sort of like a lack of interest in things. So maybe there might have been things that you used to enjoy doing, like leisure activities, hobbies, socializing, and now, maybe you might not want to do some of those things. And this is different than not being able to do those things, right? So right now, the distinction is a little bit tricky for a lot of people because you might not be able to engage in some of these behaviors with people, some of these interactions with people, some of these social activities, or even hobbies easily because of COVID restrictions. But there's a difference between the desire to do these things and the interest in wanting to do them, and sort of the lack of opportunity. So who here is finding that they are not able to do the things that they used to enjoy back pre-COVID? Right. So pretty much everyone, right? Like most things are really off the table for a lot of people in terms of things that they used to enjoy doing. Now, again, that is sort of different than this lack of interest in doing things. And that's really where it becomes more of a sort of depressive symptom, where it's not just the fact that it's not available. It's more that even if you're not able to do it, you don't care because you don't really want to do it. You don't have the energy to do it, or you just aren't really that interested. So those are the two core symptoms of depression: that feeling sad, hopeless, having that lack of interest. And that has to go on for most of the days for at least a couple of weeks. So when I say most of the days, if you're experiencing those feelings, I say, at least 4 days, more than half of the day. That kind of gets you to a point where, you've got to start thinking maybe this is more of a depression. Now, if you have those two symptoms, it doesn't just mean that you're depressed. The way that we diagnose depression is, a little bit more than just those two symptoms. You will tend to see people who have appetite or sleep disturbances, trouble concentrating, people who really kind of beat themselves up and put themselves down a lot. There's a lot of different secondary symptoms that go along with depression. Oftentimes people just complain about feeling tired all the time. Like, I just can't do anything. I can't get things done. I'm too, tired to get out of bed. Those sort of things as well. Now, there are certain medications and medical conditions that can also lead to depression-like symptoms. So, for example, steroid medications and certain medical conditions like hypothyroidism can really mimic some of those depression symptoms. But, right now, one of the reasons why we're seeing depression go up is because, COVID has really taken away these opportunities for people to engage meaningfully with other people and to do things that bring them joy. And it's really hard to replace some of those things when, they're not available. COVID fatigue, absolutely real. Sandra, that's a good point. And then, Sue, the compassion fatigue as well. I definitely understand that sometimes, it feels like you're trying to take care of everybody else, and sometimes you got to focus on taking care of yourself too. And Deborah, that's a good point, sleeping a lot. So when I say sleep disturbance, you can actually, have trouble falling asleep, trouble staying asleep, so like waking up a lot in the middle of the night, early morning waking, like waking up way before you intend or your alarm clock. Or then some people with depression will sleep a lot, like they are sleeping a lot at night, during the day, and then other people with depression, really, they're not sleeping enough. So there are many, different symptoms of depression. And when it comes to anxiety, there's also a lot of overlap between some of those symptoms. But anxiety is different in that you can have, some of the sleep and appetite and concentration disturbances, but you're also going to typically have some psychic sort of symptoms, namely meaning that they are the psychological symptoms of anxiety, like worrying, having racing thoughts, really the worrying excessively is what does it for most people. So, worrying most of the day, nearly every day for at least 6 months, that's when we start thinking more of, an anxiety disorder. So, the anxiety between, what's normal, because anxiety is actually a very adaptive thing. If you think about it, back when we were, in pre kind of industrial society, and worrying about things was protective for us, right? We had to worry about a wild animal coming, and hurting us or things like that, and it was actually adaptive to get worried in certain situations because that protected us. One of the things that happens though is that when that worrying starts becoming less adaptive, when you're worrying about all the little things that you don't need to be worrying about, or when you're worried about big problems more than you need to, when the worrying is starting to cause you distress or interfering with things, that's kind of when, it can be a problem. So how many people here have been anxious with COVID? I mean, it's if you're not anxious or nervous about COVID, then hats off to you. You're cool as a cucumber, because it's normal to a certain degree to worry about these things. Especially if you think back to the beginning of the pandemic, where we really didn't know a lot about COVID, right? And fear of the unknown, like the uncertainty factor, is actually what causes a lot of anxiety for people, right? Like if we don't know something, it makes us even more anxious. So now that we're starting to learn more about, about this virus and its effects, and how we can prevent its spread, for many people, that anxiety is starting to slowly get a little bit better. I think also combined with some, COVID fatigue. We've kind of started to, let ourselves down a bit, and then, now we're having an increase, and people might feel their anxiety going back up again. So does anybody have any questions? And you can type this in the group chat about some of the symptoms of depression or anxiety. So I know somebody here had said that they were having some trouble with their memory. So that can be, a common symptom of both anxiety and depression, or other things as well. Oftentimes concentration, forgetfulness, that can certainly be an issue. Let's see, feeling like every time you're you're having a sore throat or anything else, worrying that you might have it, that's, pretty normal for most people right now. Um, has anybody been having any symptoms that they've been really troubled by? The worrying? Yeah. Well, so one of the reasons why, you know, stressful situations like this impact us so much, there's a few different things that kind of happen. One would be that the brain has a negativity bias, right? So, has anybody ever experienced when you've had maybe 10 things happen a day? Maybe 9 of those things are good and 1 thing are bad. Now, which one is the one that you tend to remember most? It's the bad thing, right? So even if 9 good things happen during the course of the day, you might only remember, that's right, the bad one, because what happens is the brain has a negativity bias where that one bad thing is much, much more powerful in your brain, and you will actually remember that over all the good things that happened, even if they're of, the same and similar. Be, a few question here. So there's so much that causes me to worry these days. When is my worry considered anxiety? So worrying is considered anxiety when it's happening most of the days or nearly every day for at least 6 months. It's accompanied by, feeling tense, on edge, restless, trouble concentrating, trouble with sleep. And the biggest thing is really that it's causing you distress or problems day to day. So there's, a few different, and not everybody has the same exact symptoms to get, to consider it anxiety, but it's all kind of boils down to, is it causing you problems or distress with this worrying? Exactly. So, that's sort of the biggest takeaway here is that it's normal to worry to some degree, but when your worrying is out of control, you feel like you're not able to control it. It's causing you physical issues. Like there's a lot of people who express anxiety physically. So I can't tell you how many times my friends who are, in GI, like they have patients coming to them for stomach problems, and they do every test under the sun, and at the end of the day, it's actually anxiety. Anxiety can cause all sorts of GI issues, all sorts of, other things like, for example, heart palpitations, like your heart beating really quickly, or headaches. Some people will hyperventilate, or, need to use the restroom more frequently, excessive sweating. There's a lot of different symptoms that can go along with anxieties that are physical in nature. And sometimes people, especially depending on, cultural norms, some people will express anxiety more physically than talking about worrying. So it's not necessarily just worrying when it comes to anxiety. And Al has a good question. Do nightmares indicate anxiety even though I don't feel anxious or worried? Nightmares for a lot of people can be pretty normal, but some people, especially who've had past traumas, might have nightmares, and so it kind of depends. There's always a range of normal for things, and then there's also kind of a range when it becomes a little bit more problematic, right? So and Sandra made a good point that some people will get hives and have a skin response when they get really anxious too. So that's a good point, Sandra. Now, in terms of other things that impact, the brain and depression, or the brain and anxiety, so there's a few different things that are kind of going on in your brain that are thought to impact, depression, anxiety, and your ability to manage stress. So some of this is genetic, right? So some people will, find that depression or anxiety tends to run in families, and the same thing goes for, how your body kinds of handles stress. So it's normal for your body when you go into a stressful situation to react. Your body actually does it automatically. It's something that you don't even realize is happening. And what happens is there are certain hormones in your body. I'm sure has anybody here heard of cortisol? If you've heard of cortisol, type yes in the group chat. Okay, so a bunch of you have heard about the hormone cortisol. So that's the primary stress hormone. So what happens when you are in a stressful situation is that your central nervous system, and there's a variety of different mechanisms involved, but it releases cortisol essentially. And this helps activate your fight, flight, or freeze response. So thinking back to, that analogy I made earlier, when, before pre-industrial times, like you encounter a bear, what happens, right? Are you gonna fight it? Are you gonna, run away, or are you gonna freeze, right? So these are all natural responses that our bodies have to protect us. Now, what happens in somebody who does not have an, anxiety or, heightened levels of stress is that there's a feedback loop that happens where eventually you were up here, with your stress and your cortisol when this danger was there. But then as the danger goes away, it goes back down. You stop producing as much cortisol. But for some people, especially, depending on background and genetic makeups, you might have permanently elevated cortisol levels, and that can predispose you to developing anxiety and depression. Now, thinking back to this whole COVID situation, how many people have been really stressed out during this time? You can type yes in the chat box. And so I'll answer Sandra's question here while we wait for the responses to come in. So is this why the brain has a negativity bias? The negativity bias doesn't have anything to do with cortisol specifically. It just has to do with how our brain is wired to perceive negative things, more saliently, more, strongly than positive things. We don't necessarily know why the brain has a negativity bias. We just know that it's there. So there's a lot of stuff about the brain that we still don't know about. It's kind of like the last frontier in medicine, as us neuropsychologists at least like to say. Let's see. And so it looks like a lot of people have been having, a lot of stress due to COVID. Now, we know what happens when people have a lot of stress, that they tend to be at higher risk for anxiety and depression. And so when you've been experiencing stress for long periods of time, and you've been having, high elevated cortisol levels, you're more likely to have other imbalances in different chemicals in the brain called neurotransmitters. So neurotransmitters are these different chemicals in the brain that impact our thinking, our feeling, emotions, mood, and a variety of other, different types of actions that happen in the brain. So they're like the chemical messengers between the different neurons, which are the nerve cells in the brain that kind of direct, it's kind of like an orchestra, right? You have the conductor, which is the brain, and everybody's playing on their own instruments and creating this, beautiful thing that's happening. Now, the main neurotransmitters that are involved with anxiety and depression are serotonin and dopamine. So these are kind of like the feel-good, happy chemicals. And when those aren't in the right kind of combination and the right amounts in the brain, they can result in depression or anxiety. And there's this other one called GABA, which is thought to reduce anxiety, and then norepinephrine, which is thought to increase anxiety. It's kind of activating. Now, the way that antidepressants work is that they help to kind of increase the availability of a lot of these different neurotransmitters, because there's an underlying hypothesis that depression, anxiety are the result of imbalances in these chemicals in the brain. And melatonin, that's right, Dr. Trin, like melatonin can help with sleep. That's another type of neurotransmitter and hormone. And, that's something that can be very helpful for some people who are dealing with sleep issues. And in terms of antidepressants, again, those can be helpful because they impact those neurotransmitters in the brain. So when happens, so the brain is kind of like almost like a self-repairing organ, right? So it's constantly building connections between the different neurons in the brain, those brain cells, and it's also taking them away if they're not used. It's kind of a use it or lose it sort of thing. So the way that the brain communicates with each other, if you're using a certain pathway a lot, so say if you're thinking, you're stuck in a negative thought process, that becomes stronger. So you're more likely to think negatively like that. If conversely, if you're somebody who is thinking, more positively, you're more likely to think that way over and over again, right? Because it kind of strengthens that particular neural connection for you. Now, it's not that hard to actually change your brain. It's easier when you're younger. Your brain is considered more plastic or more easily changeable the younger you are, but it's never too late to kind of help essentially rewire your brain. So antidepressants, therapy, doing pleasurable activities, trying new things, these are all different things that can actually kind of rewire your brain and build. It's actually a process called neurogenesis, where you're actually creating new synapses and new connections between different nerve cells. So has anybody tried any new activities during COVID? Like some people I know took up baking or other things. Write something in the chat box if you picked up a new hobby during COVID. Gardening's a good one. Sewing, bike riding, eating, new computer skills, personal development courses, painting, jigsaw puzzles. Great, so you guys have been busy learning a lot of different new skills. Now, interestingly enough, even learning to do old skills that you do a different way. So for instance, I don't know if you guys have ever tried to brush your teeth with your non-dominant hand, but even something as simple as that can help to increase your brain plasticity and create these new connections in your brain. So, I don't want to spend too much time talking about neurotransmitters and medications more than I already have, but what are some other things that we can do to help ourselves, right? So there's a few different techniques that can be really helpful and important for people. And before I move on, does anybody have any questions about the brain and depression or anxiety before I move on to self-help techniques? Okay, great. So one of the most important things that is helpful for people, and it's an element for cognitive behavior therapy, which is a structured form of therapy that is an evidence-based way of treating depression and anxiety, is catching the positive. So sometimes people, and this also helps to combat that negativity bias that the brain has. So, keeping a gratitude journal, or even just taking some time at the end of your day to reflect on all the good things that happened can be really helpful for some people. And yep, yoga, Tai Chi, things that help you de-stress, absolutely. So there's also a variety of different relaxation techniques that you can use. So we can do kind of an exercise together. So I want everybody to take one of their hands and put it at the top of their ribs. So above your belly button, under your sternum, but right above at the very top of your belly. All right, now everybody close your eyes and take a deep breath in for a 3 count through your nose, and then hold it, and then deep breath out for a 4 count through your mouth. So you should feel your hand rising and falling if you're doing it correctly. And you can take another deep breath in for a 3 count through your mouth, through your nose, and then slowly exhale for a 4 count through your mouth. Again, if you're doing this right, your hand should be moving away from your body and then back down. So this particular technique is called diaphragmatic breathing. So this is a common relaxation technique that's used and taught as a coping strategy in cognitive behavior therapy. So this is something that you can do pretty much anytime, anywhere. And I will say practice does make perfect with this. So you can't expect to just do it, a few times and, to kind of see effects from that. But if you focus on your breath work and breathing, that can be really helpful. Praying for some people, 100%, that can be also very relaxing and therapeutic for some people. There's another relaxation technique that I like to use as well called progressive muscle relaxation. Now, if anybody's on any blood pressure medications, or if they're prone to, fainting, I would suggest that you probably not partake in this particular exercise. But this is when, if you are in a sitting position, if you start at your toes and your feet, and you kind of clench the muscles as tightly as you can. So whoever feels up to doing this, you can try doing this right now. So you clench your toes and your feet as tight as you can with your muscles. Then you start to move up your body. So if you tighten next, it's going to be your calf muscles. And then you're moving back up to your thighs and your glutes. Tighten those up as tight. And then moving up through the rest of you, then it's going to be your arms and your hands, and squeeze everything in your body really tight, and then let everything go. Instant relaxation, right? Who feels more relaxed now? There you go. So these are a couple of easy relaxation techniques that you can practice and use. Another thing that's really good is smiling, even if you don't feel happy. There's science research that shows that even when you're not feeling good, if you smile, it actually will make you feel a little bit better. It's called the facial feedback hypothesis. So even like if you're getting out of the bed and on the wrong side, sometimes the best thing that you can do is put a smile on your face, because it actually might help you feel better, even if it's forced for a while. But smiling does help you actually feel slightly happier. It's not going to, take the place of other things if it's needed, but it can certainly help. Another thing that is helpful for some people, and yes, smile under that mask. A lot of people are smiling a lot less right now because people can't see you smiling, right? So you're smiling maybe with your eyes if you're smiling at all, but people might not feel the need to smile as much, because just thinking about those social interactions are typically where we smile most. And because right now we're not interacting with people as often, like you're not walking past somebody in the store as frequently, you have a mask on, like normally you might smile at them, and you're not doing that as much, right? So smiling even under your mask, yes, can be very helpful. The other thing that I would recommend is having some sort of daily routine. And the routine part for some people is important. Some people are, they really appreciate having, set times and, set kind of things that they do throughout their day. But for a lot of people, rituals, creating daily rituals. So rituals are more about the way how you do things, right? So, for example, like a ritual would be something that you do in a way, like you have to do it anyways, or maybe you don't have to do it, but you're doing it in a way that causes you some pleasure or satisfaction in some way. So for some people, not for myself, but for some people, getting up and making your bed is a ritual, something that they really enjoy, and it brings them a sense of satisfaction when they do that. For me personally, my sort of daily ritual, I know it's been a good day if at the end of the day I'm able to do my skincare routine. That for me is a ritual. I'd like everybody to type in the chat box something that's a ritual for them that they are doing most days when they can. Eating dessert can certainly be a ritual. Stretch exercises, yoga, filling the bird feeders, walk my dog, making the bed, good for you, visualizing walking. Great. Daily devotion, working out. You guys are good. You're making this really easy for me. My next thing that I was going to say is bonus points if your daily ritual includes exercise. So exercise, even, walking, gardening for some of the folks who like gardening, Tai Chi, yoga, those are all different forms of exercise that will produce remember those neurotransmitters I was talking about earlier, like the serotonin and dopamine. That's going to help increase those levels for you. So that's going to give you that natural kind of antidepressant boost. So talking to your plants, that can be a ritual. Like as you're doing your gardening, as you're doing things, that can certainly be a ritual, and it will probably make your plants grow faster and stronger too. The other thing that's really important right now is to stay socially connected. Now, we have to stay connected even though we have to stay apart, right? So we might not be able to be connected in person, but it's so important to maintain your social relationships with people, maintain your social groups, your friendships, stay in touch with family. Having a social support network is really what's going to help, bring us out of this kind of COVID funk for a lot of us, right? And the hardest part is that when you're dealing with anxiety or depression, sometimes that loss of interest or the fatigue can make it really hard to even call somebody or respond to somebody on the phone, right? So, it can be the sort of thing where, having a Zoom meeting might be even too burdensome for you, and that's okay. It's one of those things where, you have to kind of meet yourself where you're at, but sometimes you will have to maybe push yourself to do those things if you're dealing with depression or anxiety, and that's okay too. Because a lot of times people with depression or anxiety, they will say, like, I really, I had to push myself to get here, but now that I'm here, I'm enjoying it. And engaging in some of those pleasurable activities, again, can really, help kind of pull you out. Another thing for a lot of people specific to COVID anxiety is limiting your consumption of media. So this might include the news, social media, whatever forms of media you're taking in. Maybe setting yourself on a schedule, right? So instead of looking at it throughout the day, which then makes you anxious, maybe just looking at it, one time in the morning for 10 minutes, or maybe even just once a week for some people, if it's really that distressing for you. It can be really difficult to avoid some of these things, so it's a good idea to, kind of check in with yourself and see if this is really causing you a lot of distress or not. Because for some people, getting the news actually brings them a sense of, information and control. And control can be really big for anxiety, because sometimes our anxiety goes down when we feel like we have a little bit more control over our life. This also kind of comes back to tie in and talking about some of those rituals. So for myself, like a ritual that I do is that anytime after, I've been somewhere and I get back into my car, I've got, some antibacterial wipes that I wipe down my phone and my keys, and I sanitize my hands before I touch anything. This in particular helps reduce my anxiety, because I know, I've worn a mask, I've, practiced my hand sanitization, and, I've done as much as I can to protect myself and my family. Does anybody else have any COVID rituals that they have kind of created for themselves throughout all this? Any ones that you have, you can type in the group chat. That's good. First thing, get home, go wash your hands. Oh, the UV sanitizer box. I've heard about those. I haven't tried one yet. So having these rituals, that can be really helpful. The other thing that I think is super important, carrying extra masks, that's really a good idea too. Wow, a lot of people using the UV phone sanitizer. Good for you. I'm going to have to look into this. All right, take care, Martin. So the last thing that I kind of want to really emphasize here is the concept of good enough. So a lot of people who tend to get anxiety tend to be kind of perfectionists, right? And not everybody with anxiety is a perfectionist, but sometimes what happens is that, there's a certain way that people might think that they should do things. And when they aren't able to meet that, very high bar that they're setting for themselves. It causes a lot of distress and anxiety. So, I might not have done X, Y, or Z, good enough. So what I would encourage you all to do is to kind of reframe how you're thinking about things. Instead of doing, things perfectly, to give yourself a little grace and to be able to be okay with doing things good enough, right? So, this comes to, all aspects of, your life. You can kind of take this into there and feel a little bit better about your accomplishments, because at the end of the day, even if you didn't do something perfectly, as long as you're able to get it done and get it done good enough, that should be good enough, right? Any questions about any self-help techniques for some of this anxiety and depression that we're dealing with COVID? All right, I'll try to answer them if they come up in the chat box. So what I want to move on to next is, when is self-help not enough, right? So, so after this, this event tonight, Dr. Trin's going to be emailing, if you'd like one, we can email you a free copy of the PHQ-9. This is the Patient Health Questionnaire. This is a common screening tool for depression. This is one that when you go to your PCP's office, they usually will give you this to fill out in the waiting room. But now that a lot of us may be doing telehealth, you might not necessarily be getting these forms. So it's, a good way to kind of check in with yourself and see how you're doing emotionally. So in terms of when to seek help, if this is something where the anxiety or depression is causing you a lot of distress, or it's getting in the way of your relationships, or it's getting in the way of you being able to get things done around the house. Like there's a lot of people who, really struggle to get the chores done. Like putting away the laundry is, an insurmountable, kind of task. If you're really struggling with feelings of sadness, and again, that's, most of the day, nearly every day for a couple weeks, or you find that you don't really want to do things that you used to enjoy, like leisure activities, hobbies, socializing, and you've stopped doing some of those things, and not just because of COVID, because you just really aren't interested. That's when, it becomes time to, maybe reach out for help, because depression and anxiety are treatable. If the self-help techniques that we've taught tonight and other things that you might be doing are not helpful, that's when it's a good time to reach out for professional help. Now, the different types of help, we've touched on a few of these already, but the main ways that you're going to be able to seek treatment at this point in time are a few different things. So you can try therapy. So that's talk therapy, or also called psychotherapy. That's typically done with either a licensed psychologist, an independent clinical social worker, a licensed mental health counselor, marriage and family therapist. There's a few different types of talk therapy providers out there. And, you might be able to meet with them over Zoom. Most of them are doing, Zoom therapy at this point, which is pretty convenient. Others might be doing in office still, but, for the most part, it's something that is pretty easy to do remotely via Zoom, or another HIPAA compliant, software like Doxy or other things that they might send you. And there's a few different types of therapy. You heard me mention cognitive behavior therapy. And that's a particularly useful evidence-based therapy, because what happens with people who are depressed is that you tend to have negative thought distortions. So, like some of those negative self-thoughts that you might have. Things like, nobody loves me, or, everybody would be better off without me, thoughts like that. And cognitive behavior therapy can be really useful for helping to restructure and challenge some of those thoughts. And, that's something that a lot of people find to be very helpful. And it will also teach you more relaxation strategies. But even if you don't do cognitive behavior therapy, just the act of connecting with another person and being able to express your feelings and what you're experiencing can be therapeutic in itself. It's often really the relationship that heals. So even if, you're not necessarily doing, cognitive work, it doesn't mean that therapy is not going to be as effective for you. The other option that people will usually seek out is antidepressant medications. Now, this does include for anxiety as well. So, hi, Simone, I hear you're a cognitive behavior therapist. Antidepressant medications can be helpful for both anxiety and depression, which I know sounds counterintuitive because it's an antidepressant, not an anti-anxiety medication. But the neurotransmitters involved with anxiety and depression are thought to be similar. So oftentimes, if you go to your doctor and say, I'm anxious, they will first try an antidepressant as opposed to an anti-anxiety medication, which are typically things that are kind of more sedating or really rescue medications if you're having like panicky feelings. Now, we spoke a lot about the brain's ability to kind of form new synapses, that neurogenesis, that forming new connections and new pathways in the brain. And antidepressants can help to increase those new brain connections. But guess what? Therapy can also do that. So, studies have actually shown that on their own, therapy and medication, they're actually about equally as effective on their own. So if you're somebody who is hesitant to try medication, try therapy. If you're somebody who doesn't necessarily want to put the time in doing the therapy work, because it is hard work sometimes for therapy, you can try the medication route and you will probably have about equal results. That's what the studies show us anyways. Now, to get the biggest bang for your buck though, if you combine them. So combining medications and therapy together often have the greatest improvements for anxiety and depression symptoms. Some people might complain that, I don't want to be on antidepressants my whole life. And, I've tried all the antidepressants out there. And the good news is that just because you're on an antidepressant doesn't mean you need to be taking it forever. Usually, it's something where after, 6 months, if you've responded to it, you can titrate down, which means start taking gradually less medication and then stop it. For some people, there's a lot of different new antidepressants that are out there as well. And for those who have tried a lot of antidepressants and maybe they haven't worked, there's, some new antidepressants in the pipeline, which you can access through clinical trials as well. So, there are options out there if you are interested in seeking them out. And, I know Dr. Trin would be more than happy to walk you through whatever options you might be considering as well. So I'm pretty sure I've sufficiently overwhelmed everybody with information. It's time for questions. Who's got some questions?
Amazing info. Feel free to unmute to ask a question.
Yeah. You can hit your space bar and hold it down to ask a question, and that will unmute you.
All right.
Or you can type it in the group chat. Well, gosh, I must have done a great job if you have no questions.
What is the PHQ-9? What exactly is that? Can you describe what it is for folks?
Yeah, so that's the patient health questionnaire. So what that does is it asks about a variety of different symptoms of depression and how frequently you are experiencing those. So it'll ask about, how often you felt sad, empty, hopeless, how often you've had a loss of interest over the past 2 weeks, how often have you had negative self-thoughts, suicidal thoughts, how often have you had trouble concentrating, how often have you had trouble sleeping, how often, have you, had a change in your appetite, whether that be overeating or undereating. So what it does is it kind of, it allows your doctor to kind of score up based on the symptoms and how frequently you're experiencing that. How often those are happening will kind of give them a score at the end. that will allow them to say, you know, hey, this could be depression, or, you know, it seems like you're doing well. And because again, to some degree, all of these things are normal to experience sometimes, right? Like we're not all happy all the time. You know, this is a totally normal thing to be dealing with, you know, some sadness and anxiety, especially right now with COVID. And this particular questionnaire helps you determine if this is something that maybe you need a little bit more help for, if this is something that you're really struggling with. Is it causing problems for you? So to Christy, certainly depression and anxiety can be caused by a hormone imbalance. So I kind of spoke a little bit earlier about how certain health conditions like hypothyroidism can actually cause depression. So it is entirely possible that if you have a hormonal imbalance that you can be experiencing some depression or anxiety symptoms for sure. And let's see. And it's also definitely a symptom of depression if you're crying a lot. So I know, Deborah, thank you for your brave post. You know, sometimes some people are very emotional, right? And so some people, you know, they might cry, you know, even just seeing a commercial on TV, and that's normal for them. But if you're finding that you're crying a lot, you know, that can be one of the first signals for a lot of people that they might be dealing with depression. And, you know, again, there's a range of normal there. So I don't want to overly, you know, pathologize things for you. But if it's something that you're concerned about, then, you know, that might be something to talk with your doctor about. And yes, Donna, it is totally okay to feel stressed out or sad. I want the biggest takeaway from this talk to be that, you know, a lot of these feelings are totally normal. We are going through unprecedented times. Everybody is, you know, really in this together and doing the best that they can, right? And, you know, I just want to also stress that, you know, you guys know yourselves best, right? Most people, you know, can usually figure out if something feels off. And I want to tell you to kind of go with your gut. If your gut is telling you that something is off, something is wrong, that's when I would want you to, you know, seek help. And, you know, or if, you know, the loved ones, those people around you are worried about you, that might be a good clue that maybe, you know, it's time to seek help, that it's, you know, you're maybe not coping as well as you had thought. But, you know, overall, again, most, you know, kind of COVID related stress and anxiety is very normal. You know, we're all experiencing it to a certain degree. And, you know, that's one of the big takeaways from this talk is that, you know, a lot of this is normal, but at a certain point it can become a little bit too much to handle. And that's when you would want to seek help.
If you guys are going through this and like most of us going through depression, anxiety, stress, and you're not sure if this is normal or should I get help, or is this going to be a short-term thing, or is it going to be a permanent depression, contact me. I can get you through this this little questionnaire that will actually help us determine if you're in a stage that requires more than just me saying you're doing okay. Sometimes through a questionnaire, the PHQ-9, which is used by psychologists and psychiatrists and even regular docs to determine if this is truly depression or not. It's one of the tools we use throughout the entire country. I have it available at my office, and you can simply just email me if you wanted to go through that. Deborah says, my Facebook posts keep us laughing. Okay. I'm not sure if it was on purpose or not, but yes. By the way,
laughing gets you smiling, which makes you feel better. So keep on posting them then.
Yes. Right. Simone, Simone, unmute yourself, because I know you do some cognitive behavioral therapy. I want to learn more about what you do, Simone, or your clients and all that. Are you here?
Sure, I am. How are you?
Good.
Great presentation. Great presentation. I actually do some work around emotional triggers
Hmm.
and help people understand how the things that are sort of they're unconscious of are causing their present behavior and their future decisions. And I think a lot of, as you know, a lot of our behavior are often not recognized, what the cause of or why we're doing certain things. And all we know is we keep having the same pattern again and again and again. And so really what I do is I really help people pull that apart so they can see that, and then it's not so overwhelming. And then they realize they have choice. And for me, when we have choice, we have more freedom, we have more options, we've got more flexibility. And I think we all need to come together as, having somebody else be able to reflect with you, whether it be a friend or a therapist or a coach or whoever you feel really connected with and really appreciate where they're coming from, and they're being honest and clear with you, and they're compassionate and non-judgmental, it can make a really big difference in your day. And so I do a lot of connection with people, even through text, and say, hey, how are you doing? And just connect with them. And I send them a few emoticons. And I've really learned that when you make the effort to help other people, it actually makes you feel good too, right? So.
Wow. Very, very deep. It's very true. One of these days, Simone, I'm gonna bring you on because in health, when I'm doing these lectures, right, on whether it's Alzheimer's prevention or cancer prevention or heart disease prevention, we all know what we're supposed to do already. I mean,
Sure
it's
do.
like most of it is pretty obvious, right? Healthy eating, diet, but it's like the information's there, but many times the behavior doesn't change. It's like if we all know about how to avoid, diabetes by eating healthy and exercise, why is it that 2 out of 3 Americans are diabetic or pre-diabetics? If the information is already there, right? If we
That's
all
right.
know that getting a colonoscopy is important to prevent colon cancer, why is it that the death from colon cancer is the number 2 cancer death in the United States? Why are people just not going out and getting the stuff that we obviously know are like, are obvious? And so it's something in our subconscious more than just, what we know intellectually. And it's so important to learn how to change behavior and to
And recognize what is causing that, so we can take steps to change that behavior, and then have some techniques for that behavior change. And for me, it's very interesting because I used to think that was so difficult, and I had my own challenges around behavior change. And the more I learned about how to create behavior change, I'm like, oh, well, why doesn't everybody know that, right? So, and I think all of us in the industry are all trying to support other people and helping them understand how to make that change.
right. Is it a willpower thing, or is it a subconscious change in your outlook on why you should behave differently? Or I just don't get it.
Well, and I wonder how many people think it is willpower. How many people have tried willpower?
We try willpower every January 1st. And how how successful is that, guys?
Yeah.
For about 2 weeks. Also, I think some of the issue out here is that mental health has never been kind of on par with medical health issues, right? So there is still a stigma for some people to seek help for things like depression or anxiety. There's a funny meme going around about the baby boomer who is saying, "Shh, I'm in therapy," while the millennial is going, "Hey, my therapist says," like there's a slightly different, interpretation nowadays of what it means to be getting help for anxiety and depression than it used to, even, as little as 10, 15 years ago. That can be a barrier for some people, but also knowing that this is something that over 16 million Americans this past year have had a clinical depression. Like that's a pretty substantial, number. And that's just the people who've gotten help for it. Many, many more people are undiagnosed or untreated. So this is something that's far more common than you might think. And it's something that people don't tend to talk about. And by not talking about it, we don't realize, that so many other people are in the same boat.
Yeah,
For sure. And
highlight it.
I also, yeah. And I also think that if we can be in that place of non-judgment and you see somebody's having a struggle and to really reach out to them and say, hey, it looks like you're really struggling with some things, do you want to chat about it? I think that's so healthy for us all to be in that place where people feel safe enough to have those conversations about things that they feel vulnerable about.
And not be judged.
Yeah.
Yes. I saw this today. Somebody sent this to me. Suicide rates much higher among adolescents and teenagers during this pandemic. It's affecting us all, including our kids, our grandkids, and it's such an important topic today, guys, which is why I'm so glad, Jenicka, that you were able to teach us all. And Simone, we got to get you on sometime to talk about cognitive behavioral change or something. And
all right, sounds good. It was great to listen to you, Jenicka. Thank you. It was really a great presentation.
Thank you. I'm glad everybody joined us, and hopefully I didn't over-exercise your ears too much tonight.
All right, guys. It is 7:02. It's time. Next time we chat, I want to give you an update on Pfizer's announcement today. They have the entire full data of their vaccination, and I want to let you know how that is going with that. And they also have data on their vaccination, their COVID vaccination on seniors as well, and for older folks. It looks good, and we'll go over that next time. But feel free to email me if you guys wanted to get that little screening test for depression and all that. I'll be glad to email you the tool, or I can go over it with you as well.
Yes, Bev, you can share notes from the presentation. I would be flattered. And if you have any questions, you can also, I'll put my email in there as well. If you have any questions specifically about the information that I've shared, and make sure that you get in touch with Dr. Trind for the PHQ-9 or any other questions.
All right, you guys get Dr. Jenicka's email? It's just drjenicka@gmail.com. Very cool, straightforward. Yes, this lecture is taped. Oh, I gotta send you guys the other tape lectures of the two coronavirus things we did. I have it taped and on YouTube already. Maybe I'll email it out tonight to you guys along with this one. Jenicka, I didn't get the taping from the start. So I think you started chatting a little bit. I'm like, oh crap, I gotta tape it. So I missed a little bit of it.
Wherever it goes.
Yeah, so.
And if you guys are in Dr. Trind's Facebook group, you can also find me on Facebook and Mental Health Matters with Dr. Jenicka, or on Instagram at Dr. Jenicka. So I keep it simple. It's all the same.
I love it. And then Simone, we'll find a date and we'll do something and have you come and teach our folks. All right, guys, take care. Have a great evening, and we'll chat with you soon, okay? Thanks for coming.
Thank you.
Bye-bye.
Bye.